Can you speak about what keeps you committed to the profession of art therapy?
I thought about that a lot when I read that question, and I thought, I personally feel that it's a very conflicted relationship for me. And as you mentioned earlier on, that you're just about getting to the history of the 2017 protest and what happened with the profession aligning itself with Karen Pence. So I personally feel that, you know, uh, my commitment to the profession as at large is not so much what I am focused on now. I did spend a lot of time advocating in the profession for inclusion, especially inclusion of art therapists of color. And I'm not the only one. There are several other people that I think should be mentioned. I think Gwen Short, Charlotte Boston, Cheryl Dobie Copeland, Jayshree Iyer, all of these folks have really sort of worked very hard in making sure that that history becomes visible. So with that said, at this point, I feel like, my service to the profession, I would say, in 2005, I think it was 2004, 2005, 2006, I served on the board. And I remember a time back then, just even uttering the word multiculturalism was like sort of risking it because we were predominantly a white board. So, if there was a lone person of color, and, and some of us took the risk to push back and ask for more inclusion, ask that we revisit the mission of art therapy. And so there's a lot of groundwork that's happened over the years, and I'm really pleased to see where the profession is. However, I feel like at this point, given the 2017, the protest that we did, I've sort of stepped away from the profession. I believe that there are enough people there that are talking about what we had started. I think my focus has become more on working with students as an educator. So I think that's what kind of keeps me committed to keep doing this work, because I think it's important work to do. So really my current focus is on my educator self, some scholarly writings. I think I will come back to it. I think I just needed a break for a while, because a lot of what happened between 2017 and 2022, like by this 2022 becomes till May, there's a lot that happened for me personally, and that I think I really exhausted myself in the process and really questioned whether this is where I want to be. So with that said, I still am very committed to being an educator, and I want to focus on, talking to students. And part of the education process is to really cultivate critical minds, right? And that how art therapy can be a lifelong process, not just something that happens within the closed doors of, say, a therapy room. So how art therapy can become a living pedagogy, I think that's what I'm really interested in. I think all of mental health professions, whether you're talking about social work, counseling, art therapy, all of the expressive art therapies. So, there has been, I would say, what we really need to confront is how we've thought of the concept of oppression, not the concept, but how we've thought of oppression and how it's been internalized by all of us in a way, right?
Yeah.
So I think unpacking that part of internalized oppression for all of us, whether we are people of color, whether we're white people, everybody has to do it. Because on an individual level, when we begin to talk about internalized oppression or internalized racism, it stays on that individual level. But I think with internalized oppression, internalized racism, what we begin to then think about is how are we participating? What are the ways in which we have embodied certain ideas and certain ways of being that we justify, I mean, I have done that as, say, as a chair of a department, and the ways in which I have to meet the demands of the institution that are steeped in ideas of white supremacy. So it's a very complex piece. Like, do we ever get away from this? Right? I don't know if we ever are going to be able to get away completely. And
maybe our great-great-grandchildren will.
Maybe they will, you know. So, but, you know, here's what's very interesting for me is that when the 2017 disruption happened with the profession, the people, like, we were a handful of art therapists who actually stood up. But what ended up happening was the people who left with us were all folks who were young people. You know, so the folks who allied with us were people who had students who had a course in ethics, who had a course in multiculturalism, right?
Nice.
Not that those two are the only courses, but had learned to think a little bit about the importance of culture and what was really happening. While the people who were holding on to, you know, the reins of the profession were people who had never had these courses and never really immersed themselves. So they gave lip service. So I think the profession will change, and the profession is shifting. But you know, the folks who actually cause the harm are the folks who, you know, again, they have never had the opportunity to sit down and even have to think about these things. So, you know, I think that it's the commitment is there, and I feel like that Southwestern College as an institution has always valued this. Amongst most professionals in the field of art therapy, Deb always has still, you know, been somebody to speak up for us. We're a small group of people, but, you know, a small group of art therapists, but we obviously, you know, touched a nerve in the profession. But I'm glad to see that the work is continuing. You know, it hasn't stopped. So I'm really happy that at whatever level it's happening, but it continues to happen.